open mouth, and that is only done to visualize our dens, which is our what?
Odontoid. Yeah.
Yes. So SID is going to be at 40.
Are all projections at 40? Or
Some are at 72. Okay. And then since we're only concerned with that one little piece of vertebrae, we're gonna tighten our collimation to 5 by 5. Okay, so now we're ready to go. Let me raise it up a little bit. So when you raise it up, you can tell your patient to close their eyes because you don't want to blind them, right? I'll leave it right there. Okay, so when you're ready to do your open mouth, first set up your tube to 40, make sure these two lights are lit up, and then set your collimation at 5 by 5, and then you can put your marker in any of the corners before you get your patient, so that way you're ready to go. So for this, what you do is have a little pen, and we're going to, from the bottom of her upper teeth to her mastoid tips, which are right here, the bone behind your ear, you want to make sure that line is straight. So if you could show me your face, Emily. Okay, so from her, basically her smile line to this should be straight. Tuck your chin down just, yes, right, bring it up, yes, right there. So you want to make sure that line is straight, and then the CR, you'll put it right up between her lips, right there. And then we want to match it with our Bucky. Make sure she's centered. Good. Now at this point, once you have everything centered, you're going to tell the patient to open their mouth really wide and say ah. Say ah, and then expose when they're saying ah, and then they can relax. And the important thing with this is you don't want to have their skull like tilted back, because then it'll obscure what we're trying to see.
okay.
So make sure that line is nice and straight.
Okay.
That was our AP open mouth.
Okay.
Any questions about that?
She just covered
No.
one. It was just one.
So as
Okay.
long as the line is like this,
Mm-hmm.
Well,
it's
we
straight.
got it on
Yes.
video, but
Yeah, you put the central ray between their lips, but the important thing is you don't want their chin too up or too down.
Can you do the pin thing like on her cheek so I can see?
Mm-hmm. So like if she's straight like this, from her bottom of her teeth, of her upper teeth, to the bone right here,
Okay.
you want that line to be straight. So bring your chin up just a little, right there. Mhm.
Okay.
So that was your AP open mouth. There was no angle. SID was a 40, and our collimation was very tiny, 5 by 5. Hi,
Okay.
Jay.
You said bottom of the upper teeth?
So like your upper teeth, from the bottom of that, basically like where your lips are,
Mm-hmm.
to your mastoid tips, you want that line to be straight. Okay? Now, next we have let's do our APC spine, which is also AP axial, because there's always a 15 to 20 cephalic angle. So Melanie, if you could give me a 20-degree cephalic angle. Also, when you do this, make sure your patient is not being blinded. So you'd be at 105, 15 to 20.
Sorry.
Just close your eyes, patient. And then of course our SID is going to be slightly off because we have that angle. And we're going to center at C4, where it's your thyroid cartilage or your Adam's apple on men.
Right here?
So let's see, right.
So will you
there.
just tell the patient to touch their?
You can eyeball it too.
Okay.
Yeah. I think that's kind of easy to see.
Okay. And so our collimation for this, since we're looking at the entire cervical vertebrae, is going to be slightly longer. We want it to be 10 inches. Close your eyes, Emily. That's good. And then on the sides, you just want it 1 inch past the shadows of her neck, so about that much. So if you guys come on this side, you see how the light is going through kind of the middle of her ear?
Yeah.
That's exactly what you want. So 15 to 20 cephalic angle, SID was a 40. Lengthwise, you want it to be at least 10 inches. Top of the light should go through the middle of the ear. Centered at C4. And patient's MSP is centered also. And on the sides, you want the collimation 1 inch on both sides, so you can use either marker. Okay, so that was your AP C-spine.
And axial?
Huh?
And the axial?
Yeah, AP C-spine is automatically, you know there's an angle, so it's axial.
Okay.
Okay. Let's do our oblique C-spines, page 151. So your obliques and your lateral C-spines, they're done at 72. So, who wants to move my tube for me?
You said 72?
Yes. No
Can you
angle,
repeat that
just
one more time?
your oblique C-spines and your lateral C-spine are at 72. And then your obliques do have that 15 to 20 angle, but since it's flat, let's go ahead and do your lateral. So turn to your left side. Okay. Let's see.
They have to be locked.
Yes. So make sure these blue and green are lit up. We're at 72. Centering, where do you think we're gonna center? C4. C4. You can close your eyes.
So for C-spines, you always center a C4.
Step forward just a little bit. You want that line going through her MCP, right middle of the body. And then collimation for this is going to be 10 by 12. Okay. Make sure patient's nice and centered, and then you can slap your left marker on here. Make sure their shoulders are relaxed and not hunched up, because you don't want your C7 to be blocked. So relax your arms by your side. Good. So that's your lateral C-spine, done at 72. No angle, and then collimation is 10 by 12. Let's see, where was lateral C-spine? 147. Okay, any questions on the lateral?
Yeah, what are the written instructions?
For the C-spines, I'm gonna say don't worry about breathing. For the T-spine, yes, because it's in the thorax.
Okay.
So we'll get to that in a second. Also for whenever you do your C-spine, make sure patients take off all of their earrings, because they will show up. And so now, let's go ahead and put a 15-degree angle on that tube, cephalic.
I have a question.
Yes.
So yesterday, when Mr. Donnie was lecturing, he was
Mhm.
saying, or in all the images he showed,
Mm-hmm.
in the C-spine, the trachea was full.
Uh-huh.
So is it like inhale and suspend?
Let's see what this book says.
It says respiration suspend.
So basically, stop breathing.
Okay. Does it hold your breath?
Yeah.
Okay.
Even the shot has some lighting.
Yeah, it just says suspend respiration.
Okay.
I guess it's-
Stop the breathing after breathing.
Because the trachea is right here in front of the spine. The only one that matters is the AP shot.
So I guess the breathing is for, to eliminate, motion. So just suspend the C-spines on expiration, unless it's something special view or something. So oblique, go ahead and stand AP for me. Okay, so we have AP obliques and PA obliques. For our AP obliques, we have our RPO, so let's do an RPO. Okay, so she's gonna be in a 45, hit the light for me, Smith.
Mhm.
Is it centered at C4? Bring the tube down?
Yeah, it's right there. Let's see.
Right there should be good. So she's in 45. Make sure you turn your head slightly. Good. So that opens up that foramina in the vertebrae. This looks too much. Right there. Perfect. And then step forward just a tiny bit. Good.
Mhm.
So we have space behind her head, and we have some space here. Let's adjust the elevation.
So shoulder doesn't have to touch.
Oh, yes, step back. Perfect. The light should just go through the middle of the EAM. So make sure there's light behind her neck and in front of the neck. So with our AP obliques, the side of interest is the one that hits the light. So she's in an RPO, so our side of interest is
The left.
the left.
So this is not like the lungs then?
The ribs, no. Don't even think about the
I
ribs
mean,
right now.
the-
Not even thinking about it.
Cause if it would be the ribs, that means it would be the right side. Right?
Mhm.
Bonilla, you see?
I was like, I'm not even gonna think about it. So AP obliques for the C-spine, it's our side farthest away from the IR.
Okay.
But when you do PA, turn all the way around. Give me an LAO, perfect. So something changes. Our angle is going to be caudal instead. 15 to 20 degrees.
Go for the PAs.
Mm-hmm. Still entering
C4?
In the book, it says C5, but just do C4 to keep it all the same. Step forward. Right there. What did she just say? Is that what I heard? The centering looks a little too low, so let me fix it. Okay, so this was a PA oblique, so our side of interest is going to be the opposite. So this time it's our left side that
Side
we're looking
touching.
at. Mhm. Anyone confused?
No.
Okay, so for our AP obliques, how is our tube?
For the AP. Oh,
20
cephalic.
cephalic.
And then for our PA,
20
Caudal.
yep,
Is it 20 or 15?
15 to 20.
Okay.
So you can use either or. All right, so that was our oblique ribs done at 72. Oblique ribs. Oblique C-spine done at 72. Let's see, what else can we do on the bucket? We can do the AP Fuchs. That's on page 143. So the Fuchs, you can do it either on the table or with the patient sitting down. If you could give her a chair, please. The Fuchs is only done in cases where you do the AP open mouth and they can't clearly see the dents. This would be like a second option.
So would you do the dents and then this Fuchs, you would send both?
So your first X-ray would be the open mouth, and if you can't clearly see the dents, then you would try doing the Fuchs, and then you would send both. Yes.
Do you need to order for those?
No, I don't think so.
I think you just have to make like
A
another
note
box
as to-
and put
Add
like
a
the
view.
Yeah.
Fuchs. Yeah, add a view, that's
Oh,
it.
okay.
And then you would put a note as to why you did that extra image. Okay, so oh, my wrist hurts from doing this.
Got that
So for
carpet
the
on?
view, I know, right? Typing all day. SID for this is at 40.
We're trying to finish here with two.
Close your eyes. It's because I'm doing it with one hand, that's why. Watch your head, I'm gonna drop the bucky down. Scoot your chair forward just a little. Centering is, okay. So the centering for this is going to be right underneath our chin. So this area right here. I'm gonna go up.
So like C3?
Yeah, around C3,
Yeah,
right under the chin.
C4 is right here,
Mm-hmm.
so what, like green?
So for this one, what you have to make sure is the chin and your mastoid process is perpendicular. So from your chin, lift your chin up for me. A little bit more, perfect. So this line from the chin to back here should be straight. And then scoot your chair a little to your right. So she's MSP. Maybe, well, that bucky's good. Collimation is gonna be 5 by 5. Close your eyes. Okay, lift your chin up for me. Good. A little bit more. Okay, so this is our Fuchs. Centering goes right under that chin. The line from your chin to your mastoid process is perpendicular. Collimation is 5 by 5, just like the AP open mouth. And you can do it with the patient sitting like this or laying on their back on the table. You can relax that one.
No open mouth on this one?
No, Fuchs, you don't open the mouth.
Would that bring the chin back down into the shot?
If they open the mouth, yeah, the mandible would be in the shot. Alright, so that is it for the wall bucky. If you could set up the table for me with a sheet. Oh, and someone get me a 10 by 12.
We're moving on to thoracic.
There is 2 more for the C-spine and then we'll do thoracic.
Okay, turn this off.